Every single day, in a bathroom somewhere in America, someone who felt perfectly fine collapses to the floor, unable to call for help. It wasn't an accident. It wasn't bad luck. It was a silent mistake made inside the shower stall. A mistake they'd been repeating for decades, never knowing that one ordinary morning would be their last. Here's what nobody tells you. The bathroom is the most dangerous room in your home if you're over 60. Not because of the wet floor, not because of the slippery tub, but because of 5 habits that almost everyone considers completely harmless. Habits that emergency cardiologists recognize instantly when a case comes through the door. You probably made one of these mistakes this morning. And the third one on this list is so deceptive, it works in complete silence. No warning, no pain. And it shows up in autopsy reports more often than most people would believe. If you're over 60, or if you live with someone who is, don't go anywhere until you've heard everything I'm about to tell you. I'm Dr. Michael Grant, a physician with years of experience treating cardiovascular patients. If you want to keep receiving this kind of information, the kind doctors share in their offices but that rarely reaches you before something goes wrong, subscribe to this channel now and hit the like button. Every video here could make a real difference in your health. Now, before we begin, let me ask you something. When you step into the shower, do you lock the bathroom door? Do you wet your head first? Do you usually shower right after dinner so you can go to bed clean and relaxed? If you answered yes to any of those, this video was made for you, and I'll explain exactly why each of those answers represents a genuine risk. But before we get there, you need to understand what actually happens inside your body during an ordinary shower. Because only when you understand the biology will you truly grasp why these habits are so dangerous, especially after 60. Your body after 60 doesn't work the same way it did at 35. That's not weakness. That's not disease. That's biology. Your arteries lose elasticity over time. They become stiffer, less capable of quickly adapting to pressure changes. The autonomic nervous system, which automatically regulates your blood pressure and heart rate, becomes slower to respond. And your heart, after decades of continuous work, has a smaller reserve for handling unexpected surges of effort. This doesn't mean you're fragile. It means you need information, because with the right information, every single one of these risks is preventable, and that's exactly what I'm going to give you. Habit number 1. Extreme water temperature. Picture this. It's a cold winter morning in January. The bathroom is freezing. You turn the shower to the hottest setting and step under the water before it's even had a chance to level out. That heat feels like instant relief. Your shoulders drop, the tension melts away. It feels like wellness. But to your heart, that moment reads as an emergency. Here's the biology, explained in a way that actually makes sense. When very hot water hits your skin suddenly, the blood vessels near the surface dilate rapidly. They open to release excess heat. This causes your blood pressure to drop quickly. Blood literally pools in your extremities, away from your brain and heart. Your brain detects this drop and fires off an emergency signal. The heart must beat faster, harder. For a healthy young person with elastic arteries, this is compensated in seconds. For someone with stiffer arteries or imperfectly controlled high blood pressure, that sudden demand can trigger angina, an arrhythmia, or something worse. Now, flip the scenario. It's the middle of summer, a brutal heat wave in Phoenix or Houston, and you jump into a cold shower to cool off. The effect is opposite, but equally dangerous. Cold water causes an immediate, violent vasoconstriction. Every blood vessel snaps shut at once to preserve core body heat. Imagine squeezing a garden hose at full pressure. The pressure inside surges. That sudden spike in blood pressure can be enough to rupture an already weakened cerebral vessel, or to push a heart that's already working at its limit over the edge. James, a 68-year-old retired teacher from Ohio, had no serious cardiac history. He walked regularly, watched what he ate. One cold January morning, he stepped into a frigid bathroom and turned the shower all the way to hot without waiting for the temperature to stabilize. His wife, in the kitchen, heard a dull thud about 20 minutes later. She found James sitting on the shower floor, confused, his speech slurred. It was the beginning of a stroke. The attending physician was direct. Thermal shock was the trigger. James survived, but dealt with speech difficulties for months. The good news? What happened to James is completely preventable. No equipment, no medication, no radical lifestyle change required. The rule is simple. Shower water should be lukewarm, close to body temperature, between 90 degrees and 100 degrees. Not too hot, not too cold. Before stepping in, test the temperature with the inside of your wrist, where the skin is thinnest and most sensitive. If the water burns or shocks your wrist, it will do the same to your cardiovascular system. Enter slowly. Don't throw yourself under the stream. Give your body 30 seconds to adjust. That half minute could be the difference between a relaxing shower and a medical emergency. Habit number 2. Wetting your head. First, when you step into the shower, what's the first part of your body you wet? Be honest, most people go straight for the head, to wet their hair, to wake themselves up, out of pure automatic habit. It feels completely natural. But from a cardiovascular physiology standpoint, it's one of the most dangerous things you can do after 60. Here's why you'll never forget this. Your head and chest together are the thermal control center of your body. They contain the highest concentration of nerve receptors connected directly to your cardiovascular system. When water, even lukewarm water, suddenly hits these areas, the brain interprets it as an emergency temperature shift and fires off an immediate, intense response. A massive surge of blood redirected toward the head and chest all at once. Think of a calm river with stable banks. Now imagine suddenly opening a floodgate and sending twice the volume of water through the same channel. The river overflows. The banks give way. That's exactly what happens in the cerebral blood vessels when you wet your head abruptly, especially if you have hypertension, even controlled, or any arterial plaque, even minor. Intracranial pressure spikes explosively. For an already weakened vessel, that pressure peak can cause a tiny rupture, what physicians call a hemorrhagic stroke. You don't feel pain immediately. What comes first is sudden confusion, blurred vision, an unusual weakness in one arm or leg, and at that moment you're alone, undressed in a slippery environment. Every condition for a catastrophe is in place. The solution has a name in medicine: vascular progression. The principle is to wet the body from the extremities inward, from farthest from the heart to closest. Start with your feet and ankles. Hold there for a few seconds. Move up to the calves and knees, then hands and forearms, then hips and abdomen. Only after that, shoulders, chest, and finally the head. This progressive sequence gives your blood vessels time to gradually adapt to the temperature and the stimulus, preventing the vascular flood that happens when you wet your head by surprise. It sounds like a small detail. It isn't. It's the difference between a safe shower and a silent stroke trigger. Habit number 3. Showering right after a meal. You've probably heard that you shouldn't shower right after eating. Most people know this vaguely, but dismiss it as an old wives' tale. Something Grandma used to say, nothing that really applies in practice. Let me explain exactly why it applies. Because once you understand the biology, you won't want to take the risk. After a meal, your body enters a state of intense internal effort. Your digestive system demands an enormous volume of blood to process food. Your heart works harder to ensure that supply. Circulation is rerouted, prioritizing the stomach and intestines. Physicians call this postprandial hyperemia, a vascular redistribution that's completely normal, but that puts the heart in a state of elevated demand. Now imagine that while this is happening, you take a hot shower. The heat causes vasodilation in the skin. Surface vessels open to help release heat from the body. Suddenly, your blood receives two urgent competing requests at the same time, the stomach saying, "Send me blood to digest," and the skin saying, "Send me blood to cool the body down." Your heart is caught in the middle, trying to serve two systems simultaneously. The result, neither the stomach nor the skin gets what it needs, and worse, blood flow to the brain and the heart itself drops to dangerous levels. This can trigger what's called a transient ischemic event, a momentary oxygen deficit that passes unnoticed in healthy young people, but that in someone over 60 can translate to fainting in the shower, chest pain, or worse. Many cases classified as unexplained drowning in home bathtubs, when investigated closely, turn out to be exactly this: a fainting episode caused by this circulatory conflict. The person got into the tub after dinner. The body couldn't sustain circulation. They lost consciousness and slipped underwater. Not carelessness. Biology that was simply never explained to them. The rule: after a light snack, wait at least 45 minutes. After a full meal, lunch or dinner, wait a minimum of 2 hours. Not an exaggeration. Physiology. Habit number 4. Stepping out into a cold bathroom. There's a specific moment in your shower that cardiologists consider equally or more dangerous than anything that happens under the water, and almost nobody talks about it. It's not when you step in. It's when you step out. During a hot shower, your blood vessels are fully dilated. Blood pressure is low. Your heart is relatively calm. You're in a state of deep vascular relaxation. Now, the moment you turn off the shower and step out, the cool air of the bathroom hits your wet skin. The water evaporates rapidly, and evaporation pulls heat from your body abruptly. Your nervous system goes on immediate alert. It needs to retain heat. The blood vessels that were wide open slam shut in an intense vascular spasm. Blood pressure, which was low, surges to high levels within seconds. This seesaw effect, very low pressure to very high pressure in a matter of seconds, is what cardiologists call pressure lability. And for arteries that no longer have the elasticity of youth, that sudden oscillation is an assault. This is the exact moment when most orthostatic syncope episodes in the bathroom occur. Your brain doesn't receive enough blood for an instant, and you feel that sudden dizziness, that darkening at the edges of your vision, that sensation of the floor dropping away. If you fall onto ceramic tile, against the vanity, against the edge of the tub, the consequences are serious. A hip fracture at 70 is not just a fracture. It can be the beginning of a deterioration from which many people never fully recover. The fix begins before the shower, not after. Warm the bathroom before you undress. A small space heater running for 10 to 15 minutes is enough to ensure the air won't create thermal shock when you exit. Aim for around 72 degree to 75 degree. Dry yourself off while still inside the shower stall, while there's still steam. This reduces evaporation and thermal shock. And never open windows or doors during your shower. A draft of cold air on wet skin is an immediate arrhythmia trigger. These precautions seem small. They're the exact kind of thing that determines whether an incident becomes a tragedy. Habit number 5. Locking the bathroom door. This habit is different from all the others. On its own, it won't give you a stroke or a heart attack, but it's the one habit that transforms any of the previous 4 into a situation with no way back. Do you lock the bathroom door? Most people answer yes, automatically by instinct, because that's simply how it's always been done. Privacy feels non-negotiable. No one questions it. But there comes a point in life when this habit needs to be reconsidered. Not because your privacy matters less, but because the medical math changes completely after 60. In emergency medicine, there's a concept called the therapeutic window. For a stroke, that window is roughly 4 hours for clot-dissolving medication to be effective. For a heart attack, every minute without treatment means permanent loss of cardiac tissue. Neurologists often note that in an untreated stroke, approximately 2 million neurons are lost per minute. That's not a figure of speech. That's a real count. So think about what happens when you experience one of the events we've described. A faint, a fall, a heart attack, a stroke, behind a locked bathroom door. People outside hear the shower running, or a silence that doesn't feel right. They knock. They call your name. They try the handle. Nothing. They have to find a tool. Call 911. Wait for the crew to arrive. Convince someone to force the door. Every one of those steps consumes minutes while you're alone inside, and the therapeutic clock is running. Cases like this arrive at emergency rooms every week. A paramedic reaches the front door in 8 minutes, but spends another 12 getting into the bathroom. Those 12 minutes leave permanent marks on the clinical outcome. The change required here isn't giving up your privacy. It's replacing one habit with another. If you live with others, establish a simple household rule. A closed door means occupied. No lock needed. A verbal, "I'm in here" before someone enters resolves the same problem the lock was solving, without the risk. If you live alone, the protocol is different but equally important. Bring your phone into the bathroom for every shower. It doesn't need to be in your hand, just on a dry surface, away from the water, ideally in a waterproof case or bag. What matters is that in an emergency, you have a way to call for help. Another excellent option for those living alone: waterproof personal emergency response buttons available at pharmacies and medical supply stores. A button mounted on the shower wall that, when pressed, automatically alerts a family member or emergency services. And if you ever renovate your bathroom, consider installing an outward swinging door or a sliding door. If you fall against a door that opens inward, your own body blocks the entrance. Even without a lock, that architectural detail costs lives. This may seem like overkill right now, but you don't need to have had a scare to take it seriously. You just need to understand that prevention works precisely because it acts before the problem arrives. The 5-Habit Safety Protocol. Your summary habit. 1. Wrong water temperature. Water that's too hot or too cold creates cardiovascular shock that stiffened arteries can't compensate for fast enough. Solution. Lukewarm water, 97 to 100 degrees. Tested on the inner wrist before entry. Habit 2. Wetting the head first. The head and chest concentrate the receptors that trigger the most intense cardiovascular response. Hitting them suddenly can cause an explosive spike in intracranial pressure. Solution. Always wet from feet to head, progressing slowly. Habit 3. Showering right after eating. Digestion already puts the heart under elevated demand. Adding thermal stress creates a circulatory conflict that can result in fainting or ischemia. Solution. Wait at least 45 minutes after a light snack, 2 hours after a full meal. Habit 4. Stepping out into a cold bathroom. The transition from shower heat to cool air triggers a sharp pressure swing that is especially aggressive to an aging cardiovascular system. Solution. Pre-warm the bathroom. Dry off while still in the stall. Avoid drafts. Habit 5. Locking the bathroom door. In an emergency, a locked door eats the minutes that determine whether an event is reversible or permanent. Solution. Closed but unlocked door, phone always accessible, emergency button if living alone. 5 habits. 5 simple solutions. Not one of them requires a doctor's visit, a prescription, or a single dollar spent. They only require that you take seriously what your body actually needs after 60, and that you pass this information along to someone you love. Because here's the most important point of all. The person who needs this most probably isn't watching right now. But you know who they are. The stubborn friend who skips checkups, your mother, your neighbor who lives alone. Sharing this with them might change the outcome of a moment that, without this information, could end in a way no one is prepared for. I'm Dr. Michael Grant. Take care of yourself with the same faithfulness your body has shown you all these years.